The goal is pretty simple. I want to listen to what the needs of the hospitals are and the needs of the federal health centers are in the 48th District. Take those concerns back to Springfield when session begins in 2018.
The rural areas have a hard time recruiting physicians in specialty areas, and they may not have access to that level of care. And the telehealth piece allows them to access that care immediately and oftentimes with leaders in those specialty areas.
And so we heard, for example, that if you live in Effingham, you have to drive 2 hours to see a neurologist. We have fellow citizens of our state that have to drive 2 hours to get critical health care. That shouldn't happen. There's ways to bridge that, and St. John's here is taking those steps, and the state should help those efforts.
Telehealth services are not a different kind of medical care. It is just medical care and a different method. So parity law around providing reimbursement at the same level as Medicare, Medicaid is an important part of that.
Meeting with the representatives gives us a chance to tell our story, and the people that we've elected here are great listeners, and by sharing the information with them, they're able to go back and look at legislation and see how it might impact the people that they represent, and they do that faithfully.
It's important that downstate residents have access to affordable quality health care, which we have today, and we have to protect those things.